Pamela, we know well about the medical and the emotional costs of cancer, but there's a financial impact as well. Tell me about it.
Absolutely. Well, there are various research projects that have found that about 90% of people who are living with cancer have faced a financial impact because of their diagnosis. So there is a significant financial cost associated with having cancer.
Tell us what the costs are. How do we incur these costs?
Well, the first cost is the loss of income. So if someone has had to leave work because they're too sick, that's the first thing. They're going to feel it financially as soon as they leave work. There's also the cost with caregivers who have to leave work. So they're caring for their family member, they've had to take a leave. But then there's other things. There's medications that aren't covered. There's things like physiotherapy, people calling long distance to family members, parking at hospitals, other medical supplies, childcare. Kind of the list goes on and on.
You know, it's interesting, you just listed a whole bunch of costs that aren't immediately apparent, and of course none would be covered by the provincial health plan.
That's right. There are some medications that are covered. So a lot of medications for people who are in hospital or going to hospital for treatment are covered. But there's a lot of medications that aren't covered, and there's also the co-pay and other parts that people have to pay.
Is it almost a done deal that cancer is going to cost us financially to some degree?
Absolutely, absolutely. And I think it's almost the biggest myth about cancer is that people kind of think, well, if I'm diagnosed with cancer, that everything is there, you know, it kind of falls into place, the money's there, the services are there, the costs are not going to be felt by me, and that is not true.
Okay, thank you, Pamela.